Okay, the baby's out. These things are huge. With this thing, my best friend. Put that straight on your... What am I doing to prevent pregnancy? Using a whole lot of attitude. I get that my productivity is down. Why do I still look pregnant? What have I done today? It's research, okay? Laundry, scrubbing bottles. Found some good mommy chat groups. I've changed my kid like 15 times. Feels like I have nothing to show for it. What do we do now? Like, I'm starving. Who is this? I bring the baby to the doctor. When do I go to the doctor again? I'm like a third stew on below deck. When did I eat last? Why does it look so easy? I didn't realize it would be this hard. When will I feel like myself again? What are some things we should know as moms the first 6 weeks after having a baby?
The biggest thing is the sleep deprivation. It's impressive. I don't think anybody has any preparation for that in life. I think realizing that your body just went through a lot. No matter which way your baby came out, I think we have to give ourselves some grace and realize we need to expect some time to heal.
What can you expect as a new mom in terms of recovery?
So whether you have a baby via vaginal delivery or C-section, things are a little out of place after the birth. And so having some difficulty with urination, urinating more frequently, sometimes some incontinence a little bit can happen in those first few weeks. Along with that, you'll have changes with all the muscles down below. So no matter which way they came out, things can feel different. You might feel a lot of pressure, pelvic pain in that area. And then the fact that breastfeeding can actually be a little bit painful. I think some people don't realize that it should be a little bit uncomfortable as your body's getting used to that. Things we need to look for that we should not have happen would be fever. So making sure that if that happens, you do call your provider and let them know. We should never be crying all day. Definitely some feelings of being overwhelmed and how do I get through this? I'm so tired, hormonal. That stuff is very normal, but we shouldn't be having a loss of interest of caring for the child.
Postpartum anxiety and postpartum depression.
Part of our routine screening at a postpartum visit to kind of discuss and ask about it, but I will see a lot of patients just glaze past it, feel like it should be normal, don't ask about it, kind of respond no when we talk about it, when maybe they do have a little bit of it and they're just not wanting to admit it. It's postpartum anxiety is really common. About 10% of women experience it. There's some mild forms of anxiety, kind of should go along with having a new baby, not knowing what to do. I think that's expected, but true anxiety, which is like constantly worrying, having irrational thoughts that something bad's going to happen, racing thoughts, difficulty eating, difficulty sleeping, those things fall into the category of postpartum anxiety that should be assessed and treated. Postpartum depression is a little different. You may hear of postpartum blues, which is something that happens in the first few days to first 2 weeks of after childbirth. And that's just milder symptoms of somewhat the same symptoms of postpartum depression, but most people feel a little bit of it, just that overwhelmed feeling, a little bit of a loss of interest in other things. They may call it hormonal. But true postpartum depression, I mean, we can start to see suicidal thoughts, homicidal thoughts, things that are really dangerous, loss of appetite, not wanting to care for the baby, potentially in severe situations wanting to hurt the baby, crying all day, multiple times a day. We really need to watch for that because that can go downhill fast. It is definitely something that we can easily treat and care for through different ways like counseling or medication. Something we can definitely get past and having some good support and just owning up to it, I think, and knowing that you have it and it's time to take care of it and so you can feel better and move past it.
What should friends and family watch out for?
Yeah, I think they're going to see it before the patient will, making sure that they still seem interested in caring for the child and they don't seem frustrated and not wanting to help anymore to care for the child. If it turns out that the mother or the father are now being the primary caretakers, it's definitely suspicious that something may be going on with mom and we need to look into it.
When should you feel like yourself again?
That's a hard question. Everybody's a little bit different. I think for most of my patients and myself, at least, I felt like 4 months was that kind of magic time. Baby's sleeping more, your body's somewhat back to normal, you're able to do your normal exercise and socialization and out and about and not feeling completely lost with no sleep.
What does it really mean to be cleared at the 6-week mark?
6 weeks just means you can go back to intercourse. So we start talking about birth control at that visit. We kind of take a look at the bottom area and make sure things are healed if you had a vaginal birth. The big thing is the fact that the vaginal area is healed or the C-section is completely healed. You can start lifting weights, you can start lifting things heavier than your baby, and that the cervix is closed enough and your uterus is healed enough that you can actually go swimming. You can completely bathe, submerge in water. You can be in a lake, in a river. river and a ocean. So I think that's a good time for people to understand that they should wait on all that until 6 weeks.
Does that numbing spray affect healing?
The dermaplast spray or the benzocaine spray is actually just a numbing spray. So it's really just for your comfort. I actually recommend all my patients to spray it before they pee and then urinate. And then you'll use that squirt bottle that we give you postpartum to clean off the area with water. And then you'll pat it dry just because of the sensitivity of the area. And then you can actually spray that benzocaine spray again because then you've just washed it off, right? So you can spray it again to help as you put the Tux pads and the ice back on. Ice is just really used to decrease the swelling. Using that in the first 24 hours after birth can really decrease the swelling that happens after childbirth. I think it's important to know though that the vaginal tears, if you had a vaginal birth, really do take a full 6 weeks to completely heal. So I'll have patients sometimes, wondering why 2 weeks in they still see some stitches and they still feel uncomfortable, and that's normal because the stitches can take up to 6 weeks to completely dissolve, and that tear still got to heal, and it's a moist area so it doesn't heal as fast as a cut on your finger might.
When do you go back for regular checkups?
So you can imagine when you gestate for hopefully 10 months, if you make it all the way, you're already almost a year past your last well woman exam, right? So we see you at 6 weeks postpartum for the postpartum visit, and essentially you're due that next month for a well woman, but we don't make you come in that soon in our practice. We actually give you a little breather from us since you've been with us for so long. So we let you come in that 3 to 6 month window of the postpartum period to just catch up on your well woman exam.
Can breastfeeding serve as birth control?
I would say yes and no. So you are protected physiologically from pregnancy in the first 6 months of breastfeeding if the baby never feeds more than 6 hours, if you never introduce any other sort of food or rice cereal or formula or baby food in that time. Now, I think most women are a little nervous to rely on that. I think most people wouldn't rely on that as birth control because what if the baby's slept a little later that day, started sleeping through the night, and then you're in trouble. So talk about progesterone only options versus barrier methods to help prevent pregnancy so quickly.
Best advice for a new mom?
I think sleep when the baby sleeps. I think it's easier said than done. I think having friends or family come over and help and do things like watch the baby while you take a nap, or do the dishes, do the laundry, bring food over. Don't be afraid to ask for help. Sometimes it does take a village to help support these kids. And I think just remembering nothing goes as planned. So give yourself some grace. My name's Alicia McIntosh. I am an obstetrician and gynecologist in Houston, Texas. I work at Bella Obstetrics and Gynecology in the medical center. I went to my undergraduate program at Texas Christian University in Fort Worth at TCU. I went to medical school at University of Texas Medical Branch in Galveston. And then I actually did my residency and training at UT Houston at Memorial Hermann Hospital in Houston.